Welcome back to Dardasha. We've been talking about a lot of different things in this channel. I'm talking this time to the parents that are waiting for my second video in regards of children with special educational needs. So the educational healthcare plan, you hear that quite often from young age, sometimes from 2 years old and sometimes from 3. If you're lucky, it will be mentioned to you when your child is around 2.5, and that's if your child goes to a nursery or to children's center where some specialist will observe that your child might need special care. And if they have seen it quite early and they advised you, I personally advise you to go ahead with it quite soon, because it takes very long time for it to be approved and established, and I'll tell you why you need it soon. What is the EHCP that everybody talks about? Educational Health Care Plan. You can apply yourself, so no one can stop you. You can apply for it. You do a parent request form. So you search online EHCP and you do the parent request form. You fill the form and you attach any documents from the people that have observed your child so far. For example, the GP, the health visitor, the children's center that he attended, or the nursery if he does. Especially with autism, I'm talking from an experience here. Most of the time, some doctors will say to you to wait until the age of 3. Even if they are delay with their speech, they say to you to wait and not to worry. But if you decide to wait, the process takes longer once you start applying when they turn 3, for example. So if you start from 2 and you start pushing for it, you will get the approval for your child to be assessed. And usually there will be some different specialists assessing your child once you have this educational healthcare plan going. An OT, which is an occupational therapist, would come to the setting where your child is and observe the child and write an assessment. So is the speech therapist, and an educational healthcare an educational psychologist would come as well, observe the child. Ideally, if they were in a nursery, that would be the perfect setting for this observation to take place. Everybody will write their notes, including the nursery staff, and that goes then forward for it to be assessed. And a caseworker will be assigned and decide whether this child is what's the word?
Meets the criteria.
Yeah, meets the criteria for to have the plan. Once they have the plan, that plan then, say for example, your child needs to be in a specialist setting, in a specialist school. And what do I mean by specialist setting? Is a school where the number of the children are much less than a normal nursery, a mainstream nursery. I don't want to say normal. Mainstream nursery will have roughly around 20 children, maybe 30 children. But in a specialist setting, you will have a class roughly around 5 to 8, and there will be extra staff there, maybe 1-to-1 as well. And in the specialist school, you will have also an OT and speech therapy within the setting, within the nursery, that will offer the environment that suits your child best. So this is where the plan comes very, very handy, especially if your child needs that type of setting or that type of school. Let's say your child is on the spectrum but can mix with other children, then you can go to nurseries that have a center. All of these things sounded new to so many moms. That's why I'm saying to you now, because if you're early, then you can benefit from all these tips and advices. So there is nurseries or schools that has a center. Those nurseries are good for the children with mild symptoms or on the spectrum, but not severe. Within the center they will have like a sensory room. What is sensory room? All of these things might sound new to you. A sensory room might be a room where the child can sit down, less light, less noise, things that they like to play with, makes them less anxious, quieter. So it's a safe space for your child to stay, and then they can also mix with the other children within the setting, so they can have both, the benefit from both within the same nursery, playing with other children. And if they get distressed and it's overwhelming, it's too much for them, they go to the center, and in that center they also have the therapist there coming to visit them. All of these things, the educational healthcare plan will make sure all these things are within your rights and your child's rights to have them, so they sort of like protect you. The one thing that happens though, if your child attends the GP or like a care center where they get something within the NHS, especially under the NHS, and they start getting seen by occupational therapists and speech therapy, this gets taken away if your child goes to a specialist setting, a special school. But if they go to a school with a unit or a nursery with a unit, they will still be seen within under the NHS. So the same sort of like routine, let's say every 3 months or every 6 months, I don't know, it depends on the plan. The plan will say what your child's entitled of. Those therapists will come to your school and visit them. So if you have a problem and whatever is written in section, I think it's section F in the educational healthcare plan, it's not been met, you can challenge it. In a specialist school, as I said, because the therapists are not under the NHS, it's all to do with education. So it will be under the education, under the local authority. So you speak to the local authority, you speak to the education setting about anything that you have a problem with in terms of the therapy, the school, anything like that. And mainly you will speak to your caseworker who is assigned when you did the educational healthcare plan. You will have one, and that caseworker will stay with you. You speak to her about school options, you speak to her about anything that you're not happy about. Hopefully, if she's a good caseworker and honest, she will try and help you as well with options. Don't believe one person. So if you go to one place and they say to you, oh no, you're not entitled, or you can't change your child's school, you're lucky you've been placed in one, go and speak to someone else. You will find someone that will be able to help you, but don't stick to one advice that might not sound the best advice ever. There are a lot of charities out there. Charities are the best places to go there for help. They're the best places to go to help you with application forms, any questions you have. I could name some, for example, Skylarks, based in Richmond. They will have another one opening in Hounslow as well. But wherever you are in London, in England, you can search for charities that will help parents with children who are struggling or have special needs. They can be really, really big help for you. So when you apply for the educational healthcare plan, it will be called EHC, as I said, P, but there is NA. The NA sound the needs. What does your child needs? When you fill the form, you write what your child struggled with. There is sections in that form that says what your child's strength is. Mention it briefly, but that's not the time for you to say, oh, my child is bubbly, my child is cute. We know your child is cute. Everyone thinks their child is cute, even if they don't. I'm joking. But that's not the time to mention all these things. This is the time to mention your worst day, the struggle, the real struggle that you face. Your child doesn't sleep at night, your child cries, your child doesn't wave, doesn't respond, doesn't look at you. There are so many concerns that you have. This is the time to mention all of these things in details. Don't miss a point. So even if you're really early stages, do write notes for yourself to remind yourself what are the things that concerns you about your child. What do you think the delays that you see? They're not there, they're not where other children should be, the milestones, they haven't met those milestones. Mention all these things. Meltdowns, behavior, sensory, physical needs, all of these things. How are they in busy environments? Their coordination, risk awareness. Are they aware of risks, danger, dogs, I don't know, all of these things. Mention all of these things, and mention the social and emotional support that you think you need and your child needs. There's a time scale, and usually between 6 weeks. Then they give you the decision. The advice then get collected from health and social psychologist, from the school educational psychologist, OT. All of these people write their comments. There's 16 weeks when the decision comes out. Unlawful conduct, if any of these are not carried out for your child. So if any of those people have not seen your child, there's a big question mark. You can say no, this is not right. All these therapists need to assess my child. Some of the charities also that I can mention here, there's one called Parents in Need. They provide funding. There's legal aid, or you can go private and pay. Okay, what else have I not mentioned? Week 16 is very important. If they say no, you need to go and appeal. Week 20, when the final plan should be issued. So in week 16, I might have said something about how many weeks they are. Maybe I was confused. But here, week 16, if they say no to you and you want to make appeal, this is the time to make appeal, because you have 20 weeks when the plan should be issued. Section F is the legal part, and that's where they're going to say how many hours your child needs to be seen. Ask other people, ask advice. They said 4 hours, they said 14 hours, they said 16 hours. How many hours am I entitled for? Ask, because then you might be able to get all the hours, and read what these hours for, because some hours would say 4 hours face to face, 16 hours writing, the assessment, all of these things, and some hours for to train the staff. So be aware when you read these hours what it says in there. Ask for advice whether it makes sense to you or not. And then next video I will talk about annual reviews and about phase transfer and other things. If you have any questions, do write them in the comments. If you did your educational healthcare plan and it was a positive process, also share with us what have you done. And if you have no clue, get in touch, write to me. If you need more advice in one-to-one or where to go, I could also provide you hopefully with some more advices. I think I spoke enough. Have a good evening, good night to you all, and see you in the next video.